Hey class, and welcome to my deep dive project, and I'm going to be talking about the Scrub Hub. Let me give you a little bit of background information about myself. I'm an ICU nurse in Memphis, Tennessee, and on any given day, myself and my coworkers and physicians have to deal with what's called a central line. Basically, it's a long-term IV catheter. This is the big long part that goes into you. Generally speaking, it goes in your neck or in your chest, sometimes in your leg, and it gives us the ability to give certain medications and drugs over a longer period of time than you would be able to with just a regular IV. Now, one part about having a central line that is a negative is that there is a huge risk for infection if they are not cared for properly. Last year, there were approximately 30,000 bloodstream infections associated with central lines. And in general, the general healthcare population, there was upwards of 250,000 of these infections associated with a central line. And the bad part is that up to 25% of people who get these infections end up dying. So people die, and it hurts the bottom line. Two bad things if you're in the healthcare business. Now, last year, the median cost associated with these infections was about $19,000. Now, if you just took this median number and multiplied it times the amount of ICU patients who got these infections, you would have saved the healthcare system over $595 million, which would have in turn saved patients money as well. Now, a big problem that I've noticed with these central lines is that you have to what's called scrub the hub with alcohol. So you take the alcohol pad, you have to scrub the hub for 15 seconds all the way up to 60 seconds according to some hospital policies. Now, for me, this takes time away from other patient care, or say a person's going into cardiac arrest and you have to give them medications extremely fast. Do you want to sit here, scrub for up to 60 seconds while this patient may be dying? I would prefer not to, and I assume that if you're in a situation where this is your family member, you would not want someone to wait around either. Another bad thing is that a lot of nurses do not follow these guidelines just because of, I guess, time-saving factor, or not really sure why. There's not a specific number, but just as a clinician, I've seen people not abide by these rules just because of inconvenience. So what I've decided to do is create what's called the Scrub Hub. What it is, it's a dual-sided lower lock catheter, and it is impregnated with a material or substance called chlorhexidine, which is a very strong antibacterial. So the basic premise of this is you would have your regular end to your IV catheter that goes to your central line, and you would attach the Scrub Hub, which is obviously impregnated with this antibacterial solution. So it would be on there. Ooh, little piece fell off. So it would be on there like this, ready for you to go. Now, the good part about what my creation is versus what already exists is that as soon as you take this off, this is ready to go. In a lot of healthcare systems, they have caps that have alcohol in them, and you can keep them on the end of IVs or catheters. But after you take them off, you have to go ahead and scrub again, which kind of seems like a waste of money and a waste of time. So the good part about this is it's on. You take it off, and you can immediately give whatever medications, drugs, fluids that you want to do. Another good aspect is that it's color coordinated based on the date that it needs to be changed. So there's different colors for different days, and you put it on, you know what day it was put on in case you don't use it, and that way you know after 48 hours that you need to change it out. Another good part. Also, the color coordinated is rubber grip tip for ease of use. A lot of problems with the end of catheters or with syringes is they're very slippery. Your hands may be wet, you're wearing gloves. It's not the best thing, you slip. So you have an easy to use grip on top of there. The last, and I think one of the best aspects of this innovation, is that it is dual-sided. So versus just using one time, take it off, have to throw it away, as soon as you're done, you just reattach the other side to it. So it's a dual use catheter. I think as a nurse and as a healthcare worker, this would be an amazing thing to have. And I think it would save a lot of lives and save a lot of money. And I think it'd be a great thing. Thank you for listening. Have a good day.